Hello, it's Dr. Rachel Brown with the weekly Prisma Health Business Health Solutions COVID and Wellness Update. Today is April 2nd and it's 8 a.m. So understand that the information I share with you today may change at any time. For example, one of the biggest pieces of news we've gotten recently that happened right after the recording of this video last week is that in South Carolina, eligibility to get the COVID-19 vaccine has been opened up to everyone over the age of 15, so 16 years and older. This is regardless of where you work and regardless of any medical issues you may have. So what that does is make most of us, eligible for that vaccine, which is very exciting. But of course, our supply does not match that demand. So we are going to have to be patient. This is going to take several months to get this many millions of people vaccinated. But vaccination administration sites across the state are working fast and furiously to do the best they can to reach as many people as they can. The other big news this week that you may have heard is that while in South Carolina, the number of cases has remained relatively stable and fairly low around that range of 4.5% positives, nationally, we're seeing the cases go up. And I think it's important to recognize that we will likely see that due to the emergence of variants. And so we're going to talk today a little bit about vaccine hesitancy and ambivalence versus access and what that means in terms of this race that we're trying to win against the further emergence of these variants. So let me share my screen. We're going to talk about a couple of logistic issues, and then we'll go right into what you can do for your workforce. So first and foremost, once we start sharing, I want to always bring your attention to our webpage. This is where you can reach out to us by scrolling down to this phone number. If you need your questions answered, you'd like to schedule an education session for your workforce. And of course, if you want to share these videos, you can click on Watch Now and share that link. But also, I'd like to head over here to the COVID-19 DHEC page, and I'd like to look at the dashboard. I always like to take a look at these numbers because it's fun to see how this one here, South Carolina residents who have completed vaccination, keeps climbing. So already we have a third of our population with some immunity, given that they've gotten at least one of the vaccines of Pfizer and Moderna, and we have about 17% of folks who are completely vaccinated. And so this is very exciting as we see these numbers go up. We're going to see baby step relaxation of precautions, and feeling a little bit safer about getting together, not wearing masks, that sort of thing. Now, let me show you the new announcement on the DHEC page. You can see here, as I mentioned, starting on March 31st, everyone 16 and older can get this vaccine. That is very, very exciting news. But of course, logistically, there are going to be challenges around that. So what I want to point you to is this page. Find a COVID-19 vaccine location. And if you are on the Prisma Health webpage, which is our COVID-19 webpage, you can click on Get the Vaccine or find a vaccination site. And these sites will let you know where our vaccination sites are and how to register to get an appointment. So as you know, and have heard me talk about before, we use MyChart here at Prisma Health. You can register for MyChart and schedule your vaccine appointment here. If you're having trouble with that process or don't have access to a computer or Wi-Fi, you can call this number and we'll help you do that for you. We are currently releasing the appointments, vaccine appointments for the week on Tuesdays and Fridays to help you to know what days are best to look. And I will say that across the board, Prisma Health and other administration sites are seeing more and more appointments open up, and that is coming from a little bit more and more supply each week. So if a couple of weeks ago you were a little frustrated because it was difficult to find an appointment, keep trying. It's going to get easier and easier over the days and months. So I'm going to stop sharing and let's talk talk a little bit about some of the questions that I get all the time. So we've talked some about vaccine hesitancy, but there's also an emerging vaccine ambivalence. We're seeing this among our younger population and our healthy population especially. So a couple of myths that we need to debunk right away, and that is that the COVID-19 vaccines do not give you COVID-19. You cannot contract COVID-19 from these vaccines. You cannot contract any illness from the Johnson and Janssen vaccine, which you may have heard is a viral vector, because the virus that delivers the blueprint for making the protein that our body responds to, so that when we're exposed to the actual COVID virus, we've already got the building blocks in place to attack that virus. That virus has been inactivated. It cannot reproduce. These vaccines also do not interfere or integrate with your own DNA. So no changes or transformations are going to happen with your own genetic material. That's impossible with these vaccines. I've also been getting some questions around why bother getting the COVID vaccine. I hear that we can still get COVID if we get the vaccine. And what about variants? Why should I get the vaccine if the vaccine doesn't protect against variants? So let's talk about that for a second. The answer to why bother is that yes, there can be what we call breakthrough cases of COVID. So folks who have been fully vaccinated who still get the COVID infection. And we're going to see that because none of these vaccines are 100% effective. They are between 65 and 95% effective. So of course we're going to see some breakthrough infections, but the rate is phenomenally low. And so the odds are that if you get your vaccine, you will be protected from COVID. And in fact, in South Carolina right now, they're only measuring less than 0.5% of infections being breakthrough infections. Now, it might be slightly higher than that because of reporting, but it's still an incredibly low percentage of infections that you get once you've been vaccinated. So this is a highly, highly protective maneuver. If you're concerned about variants, it looks like these vaccines actually are fairly effective against the variants. They may not be as effective as they are against the novel virus, but they're still very, very effective, some more than others. And in one study, they've shown that it's actually the Pfizer vaccine, is about 80% effective against variants. Okay, so there's still that very important protection there, even if it's not 100%. The other thing that I want you to keep in mind is what they're starting to see is that even if you do have the vaccine and you are infected with the novel COVID virus or a variant, the severity of the disease is much, much lower. And this is very important because that is the goal of every vaccine initiative. Yes, of course, we want to prevent disease, but really what we're trying to do is keep folks out of the hospital and keep folks from dying from infection. And that's what we're seeing with these vaccines, even with the variants, that hospitalizations remain very low and death rates remain almost at zero. So still a good reason, despite breakthrough infections, to get the vaccine. So we have some other folks asking me, well, I'm young and I'm healthy, and so I'm at very low risk. So why bother getting the vaccine? And I'd like to talk to you about two things in this regard. And this is for our young and healthy. This is for our older and healthy. And this is for our folks who are at risk too. And the first is we're seeing more and more younger folks being hospitalized for COVID. And some of these variants are no joke in that regard. And the reason for this is that the variants are more infective. At least we know one is more likely to be passed on or spread. It isn't necessarily more virulent or able to cause more severe disease, but because our younger folks are in that population that haven't necessarily been vaccinated yet, the numbers are going to be higher in that group of folks who get infected by the variants just because they're not protected. And the higher number of cases you have, of course, the higher number of hospitalizations and deaths you expect to see just because of sheer numbers. So if we're shifting the ability of this variant to infect at a higher rate, and our younger and healthy population is the population that's not as protected via the vaccine, then of course we're going to see more of those complications occurring in the population that is able to get infected. So what I tell young and healthy people is you absolutely want to get vaccinated, because you're the ones left that this virus can infect, and serious complications can occur in young folks. But also, let's talk for a second about something called long COVID, or you may have heard these folks being called long haulers. And what we're seeing now is that in a great many number of folks who have been infected with COVID, they are having long-term symptoms, anywhere from, say, 3 weeks after the resolution of their COVID infection to 9 months. And these symptoms, these side effects or these lingering symptoms from the infection, can be pretty significant. And so, of course, we're seeing respiratory symptoms where folks are still having difficulty catching their breath. And this is young and old, healthy and unhealthy, folks who just don't feel like they have the same amount of stamina. Major increase in fatigue. We're seeing a concerning level of cognitive impairment, fogginess, not being able to think clearly for long periods of time after this infection. And we're even seeing things like gut issues, cardiac issues, hair loss, you name it. So no one wants to deal with these things. None of us wants to get this infection. We hope that if we do, it's mild and we move on. But we also want to do our best to try to avoid this long haul COVID, or long hauler syndrome, or long COVID. And I will tell you that depending on the study you look, they're showing that somewhere between 10 and 30% of folks who get COVID are experiencing these long-term symptoms. And it's likely a little higher than that. So, yet another reason why a vaccine, even if you feel like, you know what, I don't think I'm at high risk for complications from COVID, yet another reason why it's a good idea to get the vaccine. And the last one I'll share with you actually comes from a very small study. So we don't know for sure if this is the case yet, but it was compelling that the folks who had had COVID and still had symptoms, who got the vaccine, their symptoms improved. So we were able to actually change the course of that long COVID by giving the vaccine. That, of course, was not the intent, but that was what was a happy consequence of those folks getting the vaccine. So more and more reasons to get the vaccine. We do know that there are folks who have concerns and who are worried about long-term side effects, or the fact that it's been given emergency use authorization. But understand, all of these vaccines are also going through the FDA final approval process, and so far so good. And in cases where we're seeing that there is question about the data, such as AstraZeneca, they're going back to the drawing board. So the system is working, and that's very, very good news. Now, the last thing I want to talk to you about is, we've talked about hesitancy and ambivalence a good bit out in the lay press and on social media. But the other thing is, we can't confuse that with lack of access. So we know there are going to be populations, neighborhoods, communities who may very well be incredibly interested in getting this vaccine, but don't have the access. And I can tell you at Prisma Health, we are prioritizing identifying and reaching out to those very populations through our mobile unit and other efforts, so that we can get folks who don't have good transportation, don't have Wi-Fi or computers, don't have the luxury of childcare, or taking off work during the day, or maybe they work the night shift. These are folks who are having trouble getting the vaccine. They also tend to be populations that are already at higher risk for complications from the COVID virus. And so we are working very hard to reach out to those areas and make sure those folks get vaccinated. But you can look within your workforce as well and help to address some of these issues internally. So let's say, for instance, you've got a population or a group in your workforce that has trouble accessing the technology, okay, or maybe doesn't feel comfortable with the technology. Maybe they don't have Wi-Fi, maybe they don't have a computer, maybe they just don't feel comfortable using it. So please call us, have them call that Prisma number that I showed you. We can walk them through the process, get them registered, get them scheduled. You can have registration events for your workforce where you do that for them. And if you need us to train you, we're happy to do that. We can also have registration fairs if you want us to come on site and register your workforce. Think about folks with no transportation or no childcare. Maybe this is something that you can provide so that folks can get to the sites. We do know that here in the Columbia area, the Comet bus system is taking folks to the vaccination sites for free. So look around your local resources and find out who maybe can help with childcare or transportation to free up folks to be able to go and get that vaccine. And then for, as I mentioned before, for folks who live in rural areas and have little access to the vaccination administration sites already, there's good news. They are opening up many, many more vaccine administration sites. Of course, appointment availability depends on supply, which we're hoping will also slowly creep up. So there should be more and more of this type of access for folks, either in healthcare systems that bring the vaccine out to neighborhoods such as our mobile unit, or more pharmacies, more ambulatory care sites, and primary care offices that will be giving this vaccine. So again, keep tuning into these videos, keep watching the DHEC and the Prisma Health websites to find out where are there more and more vaccine administration sites being opened up and more opportunities for folks who are in rural areas. So that's it for my update today. I will tell you that there will not be an update next week. I hope everyone is able to take a little bit of a break, whether it's spring break or you're celebrating the Easter holidays or Passover or any other big event that's going on in your lives right now. You're able to take a breath and still remain safe by masking and socially distancing and avoiding large indoor gatherings. And I will see you in 2 weeks to help you all take care of your workforce.